everyone. Today we were talking about vertigo. And vertigo is a sensation that either you are moving, the room is moving, a spinning sensation. And it's actually not the disease itself, but it's actually a description of a symptom. So other associated symptoms with vertigo might be some nausea, might be headaches, might be sweating, might be a sensation of being off balance and not walking properly. And there are so many causes that what I'm about to say may not be all inclusive, but I think of it in several different categories. And one is a category of things in the brain that don't belong there. So for instance, of course, you may have a brain tumor. You may have MS or plaques or demyelinating areas of the brain that are causing it. And then you may also have conditions within the middle ear that don't belong there, or the inner ear that don't belong there. For instance, the middle ear can have fluid. The middle ear can have otosclerosis and a lot of calcium built up in the ear. It may also have a cholesteatoma or a tumor. Now, the middle ear may also have some fluid that doesn't belong in there, or endolymph that's a little bit more thick than it should be. Then, of course, you have the brain stem, and of course, it may have tumors per se. And we may also have inflammation of that nerve. Now, there's plenty of other causes for vertigo. That can be dehydration. And to that note, we have to think of other chemical causes, such as we may have electrolyte disturbances, in particular a sodium or potassium imbalance. We may also have glucose and sugar dysregulation that may wind up causing some microvascular changes, but also that hyperosmolar state as a chemical cause. And then, of course, we have to think about medications. I can't tell you how many times my patients feel off balance and are having vertiginous symptoms simply because their medications and the side effects of their medications or the interferences of the medications. So we also may have an aging phenomenon of the inner ear, such that we develop some crystals or otoliths in the inner ear that will wind up forming sediment in the semicircular canals, such that if you've been in a prolonged position for a period of time and then go to move, those little otoliths and sediment will start trying to equilibrate within the fluid and cause an off-kilter sensation. Now, vertigo will also happen when the brain becomes confused, such that you may have a pressure change in one ear or eustachian tube dysfunction and a different pressure in the opposing ear, such that the brain becomes a little bit confused with the pressure differences. There are also cervical causes and mechanical causes. So cervical implying neck, we have discs in the neck, and then we have nerve roots that come off, and those nerve roots will actually supply the face and the ear of its innervation, and that can also throw off our balance and cause vertigo. Then we have some conditions such as Meniere's, or we may have some infectious conditions such as a meningitis, a labyrinthitis, and those also may contribute to the vertigo phenomenon. Do not forget, head trauma can also cause vertigo. And then, of course, blood supply getting to the neck, to the discs, to the ear, to the microvasculature in the brain can also cause vertigo. So in that regard, we can have vascular troubles that can be contributing to vertigo. So what would the treatment of vertigo be? So here we are in an integrative phenomenon. Obviously take care of the big problems. If we have brain tumors or things that are in the way, such as middle ear fluid or otosclerosis. Those may actually require some treatments. The underlying causative evaluation may require an MRI, may require an electronystagmography, which can actually go in and assess the site of that lesion, whether it is brainstem or ear or supratentorial. Again, there is a phenomenon of nystagmus, which is the eyes going back and forth in the throes of the vertigo phenomenon, and to that regard also in the migraine phenomenon, if that is causing that. So again, we need to go at the big causes of this. Obviously, if we have some chemical contribution, we would want to maintain hydration. We would want to correct the electrolyte disturbance. We would want to correct the sugar-related issues. If we have vascular troubles, we would want to improve the vasculature, such as potentially aspirin, which could be a double-edged sword because aspirin itself as a chemical can contribute to tinnitus at high doses, and to that regard also the vertigo and inner ear phenomenon. And then of course we would like to do what we call decreased polypharmacy. The least amount of medications you need to take care of your underlying conditions obviously would be optimal. If we have discogenic causes, then we would want to have physical therapy, acupuncture, foundational chiropractic management. And that would be within the hands of professionals who know exactly what they are doing in and about that area, because we could cause some troubles. For the benign positional vertigo, and that derived from the inner ear, we may consider Epley maneuvers or modified Epley maneuvers or vestibular rehabilitation. Now, Epley maneuvers can be used in an acute phase, but to give fair warning, and this is why I don't do them in the outpatient setting, is the vertigo can get far worse associated with vomiting and disequilibrium and inability to walk before it gets better. So that should be in a monitored situation. There are some herbal remedies that sometimes have a little bit of benefit, but of course that revolves around the vascular nature, calming stress if stress is a trigger. We have some procedures within the hands of an ear, nose, and throat physician, or if there is the neurologic contributions such as MS or brain tumors or anything that would require neurology manipulation. Of course, we have our energetic field, and I would empower any of my energy workers to contribute with any of the commentary below to see what has worked quite nicely for vertigo. Acupressure, acupuncture has been used. There, I'm sure, are rife settings for this. And again, vertigo sometimes is a gentle approach over a long period of time rather than a harpoon in a short period of time, because a lot of the brain and the brain stem needs to equilibrate with these treatment regimens. Again, this is a brief overview. A lot of us suffer vertigo within our lifetime, and for most of us, it is a temporary nuisance trouble of life. But for those of you who are suffering with a chronic, daily, vertiginous situation, please seek your healthcare provider for evaluation and treatment. Again, I'm Natalie Kunzman, MD. Subscribe to my channel below. And until we meet again, be well.